Hi, I'm Alice Sanvito. I'm a massage therapist in St. Louis, Missouri, and I'm here to talk about Russian medical and sports massage and neuroscience. Russian medical and sports massage is a system of massage that was developed in the former Soviet Union. It has its roots in research that began in the mid to late 1800s and grew out of research done by doctors and PhDs at a university level, and research continues to this day. It is physiologically based. As far as I know, it may be the only system of massage that's completely physiologically based. It's a whole system of massage. It's not a technique for a specific purpose, but it's an entire system of massage. And what Russian scientists have done is to study when you do a stroke in a particular manner, exactly what effect does it have on the body? How does it change the physiology of the body? Our anatomy doesn't change. What changes is physiology. So here in the United States, we tend to teach in an anatomical manner. We say, here's a back, here's how we massage the back. Here's a leg, here's how we massage the leg. But in Russian massage, they have looked at the strokes and looked at, when you do this stroke in this manner, exactly what is the physiological effect on the body? How does it change the physiology? And so the thinking behind it is different. Instead of saying, okay, here's a back, how do you massage the back? What they're looking at is, what is your diagnosis? What's the problem? First, you have to correctly identify the problem. And when you correctly identify the problem, then you need to understand what is going on in the body. What is it that we want to see happen differently? And then you want to understand, how do your strokes affect the body? What changes do they create? And if you understand what those changes are and how to use them, then you can look at, okay, what can I do to shift the physiology of the body in the direction that I want it to go? And this allows you to work more intelligently, to have some structure, some thinking behind what you're doing, instead of just throwing everything you've got at it. Russian massage is a European style of massage. It uses gliding and kneading and rubbing, strokes and vibration, as we do in Swedish massage. However, the strokes are done in a very particular way. They have investigated the general effects of the different classes of strokes, and then within those different classes, like petrissage and effleurage and vibration, breaking them down into substrokes, doing them in different ways, and what specifically are the effects of them. So one of the things about Russian massage is that it recognizes the role of the central nervous system, and this is how it agrees very nicely with current understanding in neuroscience. Russian massage recognizes that the effects that we create with massage occur through the central nervous system, that there are mechanoreceptors in the skin, and that when we touch the skin in a certain manner, that we stimulate those mechanoreceptors. And those mechanoreceptors send signals to the brain. This information goes to the brain, and the brain decides what to do with it, what kind of changes to create. So it's the brain, not our hands, it's the brain that decides to dilate blood vessels, to change the heart rate, to change the blood pressure. And so in Russian massage, we're always thinking about, first and last, the state of the central nervous system. And we may be focused for periods of time on the muscles or tendons or ligaments, but still in the back of our minds we always recognize that it's the central nervous system that's creating the changes. This is one of the reasons why in Russian massage we have a principle of no pain. Russian massage should not be painful. It should always be comfortable to the client. And the reason for that is we want to work with the central nervous system. If we create pain, we create a stress response, and then we get the opposite of what we want. The body tenses up, the muscles tense, the blood vessels constrict, stress hormones are released, and even if this is just occurring at a subtle level, we're getting the opposite effect of what we want. So we want to work with the body's processes and not try to impose ourselves on it. So we're always working within the client's comfort level. And if we're creating pain, we back off. We take a gradual approach. You know, it didn't all happen at once. It's not going to go away at once. But if we respect the nervous system and work with it and work gently and ease our way into it, the body starts creating changes. We work with it, we nudge them along, and we can get a lot further faster by respecting the body's own processes.